Achilles tendinopathy is any type of injury to the Achilles tendon, which is the largest tendon in the human body. These types of injuries are seen across all age groups and activity levels, but about 65% of these injuries are non-sports related and are more common past the fourth decade of life. There are a variety of genetic conditions that alter the connective tissue and collagen structures, which influences the rate of Achilles tendon injuries. A couple genetic conditions that are common include celiac disease and joint hypermobility syndrome. Celiac disease affects 1% of the world's population and is an autoimmune disorder that can't digest gluten and damages the inside walls of the small intestine. Joint hypermobility syndrome also has a strong genetic component and is most commonly seen in women and children, and it contributes to injuries such as dislocations, arthritis, increased fatigue, and other joint injuries. Under the supervision of clinicians, the UNK athletic training students were able to work with the patient who was diagnosed with celiac disease and joint hypermobility syndrome, who underwent an Achilles tendon surgery. She was a 37-year-old female university lecturer who, along with walking during class, also really enjoys being active outside. Along with her two diagnoses, she does have a history of dislocations and previous surgeries. The initial injury for the patient occurred in January of 2020 when the patient stepped in a hole and heard a pop in her ankle. After that injury, she was treated conservatively with physical therapy, which focused on pain management. After she didn't really see too much improvement, she went to seek treatment from an orthopedic surgeon. This surgeon diagnosed her with Achilles tendinosis and tendinitis, as well as chronic heel pain. After the diagnosis, our patient underwent surgery and had her Achilles tendon repaired, as well as inflamed tissue removed from that area. She was then placed in a boot and was non-weight bearing when she started rehabilitation with the athletic training students and the clinicians. The progression for her rehab focused on wound care and pain management, strengthening the accessory and stabilization muscles, including the hip, knee, and the other ankle as well. And then we moved on to increasing range of motion at the injured ankle site, which then led to working on strengthening that ankle within its current range. And then as that improved, we transitioned into functional activities, including weight bearing, which started to mimic her daily activities. This case study provides us with a unique look at how multiple diagnoses can be intertwined and have an effect on other systems within the body. This stresses the importance of collecting a full medical history and looking at the big picture. If there's a chance of any of the diseases contributing to future injuries, early intervention and strengthening might be able to prolong the surgeries and improve or maintain the quality of life for these individuals.